Hello everyone. Today we will start infectious disease pharmacology. Whenever we are talking about the infectious disease, in infectious disease there are some bacterial disease, fungal disease, viral disease or protozoal disease. We are discussing here pharmacology and line of treatment or management, how the drug we are going to use along with some clinical feature of that particular diseases. So commonly occurring disease. So first we will see UTI. What exactly today we will discuss, that is the UTI. UTI is urinary tract infection. UTI is the urinary tract infection. You already know in urinary tract, the kidney where the urine is formed, then pelvis, ureter, this is urinary bladder. Okay, so this ureter open on that side. This is the trigone of the urinary bladder, internal urethral meatus. Okay, and then after that it is the urethra. Okay, so if it is a male, it is a penile urethra, and if it is the female, so vaginal urethra, right? So in male here there is a prostate, okay, and in female it is very short. Here it is very long, like 20 to 25 centimeter whole length of the urethra in case of the male, but in case of female it is very short in length, like a 4 centimeter. Now this is called urinary tract because it produces the urine here in the kidney by means of like ultrafiltration, okay, secretion, okay, and reabsorption. There is a formation of urine in case of the unit, that is nephron. From nephron it will enter into your, that is called pelvis, then ureter, and here inside the urinary bladder. Okay, and then when bladder constrict it will come out. Now what is urinary tract infection? It will be anywhere. It will be anywhere. So it will divide into two types or two part of urinary tract infection. One is called lower urinary tract infection and another is upper. Lower urinary tract, usually it is cystitis. It is usually the cystitis. And upper, it is most common is pyelonephritis. Okay, so the commonest in lower is cystitis. Cystitis is related to the urinary bladder. Urinary bladder, that is the cystitis, and upper common is pyelonephritis. This is what is the most important. There are other one also in case of upper and in case of the lower urinary tract, but I want you to remember lower cystitis and upper pyelonephritis. So lower is the bladder and upper is the nephron, or that is called kidney. Now what are the causes? Like you can see the etiology. Whenever there is a disease, there should be some etiology, right? So what is the etiology? Usually which infectious agent is responsible for the urinary tract infection? Usually 80 to 90% is your which bacteria? E. coli. E. coli is more than 80% of the urinary tract infection. It is because of E. coli. If you know the bacteria, you will know which antibiotic you are going to use against this bacteria. Now the rest of the infection, it is by fungal, right? So like E. coli is most common. Staph, okay, staph is one of the another bacteria which causes the urinary tract infection. Fungal, rarely, fungal are rare. Fungal urinary tract infection, they are very rare, right? And in case of female, here you have to remember, in case of female, because of the anatomy, you can see in male urethra, it is a prostatic urethra, membranous urethra, and penile urethra. Here is the male external genital. It's a long urethra in case of the male. But in case of the female, it is like short, 4 centimeter, and it is very short in length. And because of this anatomical difference, so in female, chances of urinary tract infection because of the anatomical difference between the length of urethra in case of male and female, it is more in case of the female. Okay, this is one. Second is sexual intercourse. Okay, that is a young human, that is called that basically the urinary tract infection is called honeymoon cystitis. That is called, this is a common name, it's called honeymoon cystitis. Okay, because of the sexual intercourse they will usually get the urinary tract infection. There are some associated systemic disorder you can find the urinary tract infection more, okay, like diabetes, obesity. So in diabetes patient, in obese patient, the urinary tract infection is more. Okay, now we know why in women because of the length of urethra. So in women, there is a short urethra, and there is one more thing, the opening of urethra in case of woman, it is very close to the opening of, that is called anus. Okay, so in case of woman, the opening of the urethra, right, and the opening of the anus, they are very close, and it's very short distance. So short urethra close to the anus. These two things I want you to remember: short length urethra and close proximity to the anal opening. And because of this, the chances of infection in case of female is more. Okay, woman is more as compared to the men. Sign. So clinically, if you want to see the sign, and you already know what is the difference between sign and symptoms. Symptoms can uttered by or explained by the patient to the physician, and physician write in the scientific language, that is called the, or see that particular thing, that is called sign. So what are the signs? Sign are like, or symptoms, they are called vaginal discharge. So if any woman they are complaining about the discharge, you should suspect about the urinary tract infection. First. Second, micturition, that is burning. Okay, so dehydration is one of the cause of the micturition, right? The urine become acidic, and that is why, because of that acidic pH, there is a burning sensation, but there is no vaginal discharge. So here you can see vaginal discharge also and burning micturition also, along with low back pain. So if you see the anatomy, okay, here basically the bladder, okay, and because of the infection here, there is a low back pain. If there is an infection, there should be a fever. And if you go on examination, the urine contain the pus cell, or might be the blood in that urine. So urine with blood cell because of the infection and pus cell, because urine form here and it will goes into the bladder. Here there is an inflammation, that is called cystitis. And that cystitis because of the infection in female. So what you can get in female? Vaginal discharge, burning micturition, low back pain, fever, and the urine. Okay, so urine is basically, they contain pus cell, the clarity of, or there is a turbidity in the urine. So pus cell and the blood cell you can find. Now causes we already know. Urinary tract, now we will go for common urinary tract infection, right? So this is all about the female. Why it is more in case of female? Because of the anatomy and because of the close proximity to the anus. What are the signs in female? Now we will see overall causes of urinary tract infection. So what are basically the overall causes of urinary tract infection? One, we already discussed, the infecting agent is E. coli. That is the bacteria, that is the E. coli. Staph is also there, fungal is rare. Second is instrumentation. Okay, so if there is a retention of urine, right, at that time we will perform the catheter. The catheter will enter into the urethra to relieve the blockage of the urine and to relieve the pain because of the retention of the urine. We are performing the catheterization, or that is called catheterization, that is come under the heading of instrumentation, right? So because of there might be a chances of infection or urinary tract infection. Okay, so instrumentation, or you can say catheterization, right? So if there is a cystitis, if the infection is here, this is all continuous. This all tract, urinary tract from kidney, pelvis, ureter, here it is a continuous tract. Infection from bladder, it will goes after some time to the kidney, and then cystitis can leads to the pyelonephritis. Okay, then this is cystitis, then pyelonephritis, then infection can lodge inside the kidney, and then it causes the abscess, in the kidney, right? So basically these are kind of like causes. So causes might be E. coli, instrumentation, or there might be some foreign body inside that particular urinary bladder or urinary tract, and they are the most important causes of the cystitis, or you can say urinary tract infection. So now we will discuss cystitis versus pyelonephritis. Cystitis, pyelonephritis. So why cystitis common than pyelonephritis? Cystitis. So in cystitis, in women, we already know shorter length of the urethra. Then another cause is if there is a stone. If there is a stone here, in case of urethra, urinary bladder, anywhere if there is a stone, that might causes the inflammation. That is stone in the urinary bladder, they causes the inflammation. So stone, stricture, because of the catheterization, if there is a urethral stricture, if there is a trauma to the urethra, that might causes the obstruction, or stricture that might causes the infection, right? So catheterization is one of the important causes that will lead to the cystitis, and cystitis again leads to the pyelonephritis. So because of cystitis, there is a pyelonephritis, and these are the causes. Okay. So basically, what you have to do the investigation. The investigations are very, very important, whether it is a cystitis or whether it is the pyelonephritis, because cystitis can lead to the pyelonephritis. Clinical feature, we already know. Frequency, increased frequency of micturition. Sign and symptoms, we already know, that is clinical feature. Increased frequency of micturition, that is one of the clinical feature. Urgency, that is called urgency. Because of the infection. Burning sensation, right? Painful, that is called urination, right? Pain in the flank region, that is called costovertebral angle, where there is a rib, okay, and here there is a vertebra. So this is on a back side. Usually in pyelonephritis, there is a lower back pain. Not in cystitis, okay. So more common in pyelonephritis, there is a lower back pain, that is called at costo. Costo means your rib, and here there is a vertebra. So here there is a lower back pain, okay. Then suprapubic pain, okay. So suprapubic pain, okay, you already know the lower abdomen, where there is a pubic region start, where there is the external genitalia. Above that pubic area, there is an area which is called suprapubic area. In the suprapubic area, there is a pain, okay. Infection, there is a fever, okay. So if you compare the cystitis and pyelonephritis, in fever is more worse in case. So all the signs and symptoms, they are more worse in case of the pyelonephritis. So in cystitis, you will not really get the fever. There is no fever or less fever, but in pyelonephritis, there is a fever. That's what the clinical feature, or you can say the difference between cystitis or pyelonephritis. Now the next thing is we will see difference. Whatever the things you saw here, we have to differentiate. So what are the differentiating features? Cystitis and pyelonephritis. So cystitis, where exactly the pain in cystitis? Suprapubic region. There is a pain. In case of pyelonephritis, we already discussed the pain is on lower back side, that is that costovertebral angle. We can write here lower back. That is at the lower back. In book it is called costovertebral angle at the back side. Okay. Now cystitis anywhere. It might be the urethra. It might be the like urinary bladder. You can say it is the anywhere. Okay. Then in pyelonephritis, it is in the kidney, that is the site. Now what about the fever? Here there is no fever, and if still fever, it's a mild one. Here it is a severe high grade fever in case of pyelonephritis. Okay. Now if you want to see which type of bacteria or infecting agent is there, what happened? If it's the patient of cystitis, the urine come for the short course of length. So you can find the infecting agent if you culture the urine in cystitis. But in the pyelonephritis, it follows the long route. So because of this long route, if you perform the culture. If you perform the culture, then it is very difficult to find which type of bacteria is there. But still, gram-negative bacteria, they are more in case of the pyelonephritis. You don't have to do the culture in case of cystitis because there is no severe sign and symptom. Now in treatment, if you want to treat, you can perform the antibiotic treatment. So that is very important part. Trimethoprim. Okay, trimethoprim you can give in case of the cystitis, sulfamethoxazole, right? So that about 3 to 7 days. Okay, so this is the treatment of your which one, that is called cystitis. In case of pyelonephritis, we can give ampicillin, gentamicin, or you can say fluoroquinolone, or in like severe cases you can also add a combinating drug, that is the piperacillin and tazobactam. So piperacillin plus tazobactam, these are the line of treatment in case of pyelonephritis. So this is basically the difference between your which one, the cystitis and pyelonephritis. So ये हो गया तुम्हारा difference. Now we will see the test. How to diagnose. Basically we need to perform some tests. Urine infection, you should go for the urine analysis. Very easy. It's a urine analysis to find out the pus cell, to find out the bacteria, to find out the what exactly which kind of infection is there. So you can perform the urine analysis, right? To look for protein. Commonly there is no protein in case of normal urine, but if there is a protein 100%, the problem is not in the bladder, the problem is in kidney, right? So here if there is a upper UTI, you can see the protein, so because here there is a ultrafiltration or filtration problem, and because of that the protein will enter into the urine. Normally it is not. So protein, then you can look for the RBCs. In a patient is having trauma history, so because of that trauma there is a injury, because of injury there is a infection or infection site is there, and there is a site for the infection. So you can see the red cell. If some patient comes with the history of trauma along with the infection, you can think about the red cell in the urine, right? So then this is all about the test. Okay, if there is a bacteria, okay, then one more thing, if there is an abscess, here inside the kidney, the test really doesn't help. Here you have to perform the scan. Or ultrasonography to look for that particular abscess. Okay, now any other investigation rather than scan this abscess, there should be a biopsy. To look for that abscess inside the kidney. Okay, so most accurate in spite of scan, it is the biopsy in with respect to the CT scan, MRI. Okay, so biopsy is very important. Okay, why? Because we cannot stain that particular abscess in the CT scan, or in case of the contrast MRI, right? And then what you can do in case of abscess, if it is already after biopsy, you can see and you can culture that specimen, then give the drainage. Drain the pus and start the antibiotic. That is the line of treatment for the abscess. Now the pharmacological treatment. We already discussed the pharmacological treatment. Now we see that drug one by one. In case of urinary tract infection, now we will grade the disease. Uncomplicated cystitis usually in female. They came with cystitis. Discharge, no fever or mild fever in case of female, and they are not complicated case of cystitis. Here, trimethoprim for 3 days you can try. Okay, the antibiotic trimethoprim you can go for the 3 days. Plus you can use the sulfamethoxazole. Okay, so plus sulfamethoxazole for 3 days. You can add quinolone also. But female with uncomplicated cases, you can just give the trimethoprim and sulfamethoxazole for the 3 days, and if it is not responding less, so you can go up to the 7 days. So this is about the female cystitis, uncomplicated. If the cystitis is present in any patient, plus that patient have diabetic mellitus, so 3 days treatment is not worthy, you have to increase the treatment. You have to increase the treatment. It should be 7 days minimum. The drugs are trimethoprim and sulfamethoxazole. Okay, or you can go for the trimethoprim plus sulfamethoxazole, or you can use for the fluoroquinolone for the 7 days. But if it is the diabetes mellitus, so this is about the female. What about the male? In case of the male patient, if there is a cystitis, what we can do? Look, here it is for 3 days, here it is for 7 days. What about the male? In case of the male patient, the line of treatment is for 10 to 14 days. That I want you to remember. The drug is same, trimethoprim plus sulfamethoxazole. In case of sulfamethoxazole, you can also fluoroquinolone. If you don't want to use sulfamethoxazole, you can go for the fluoroquinolones or quinolone. Same thing I am saying but here only the days. Female uncomplicated cystitis 3 days. Cystitis with diabetes mellitus 7 days. Drug are same, trimethoprim plus sulfamethoxazole, or in place of sulfamethoxazole you can use the quinolone. Same thing is there. So male uncomplicated. So this is about the female. This is about the complicated with any systemic disorder, most commonly the diabetes. This is about the male, and there is one more. Common cystitis in pregnancy also. This is what they ask in exam. If it is a pregnancy and if there is a cystitis, you don't have to go for a trimethoprim, sulfamethoxazole or quinolone. Okay, here 10 to 14 days antibiotic course of which drug? Nitrofurantoin, okay, or amoxicillin. Nitrofurantoin, or you can go for the amoxicillin. Okay, if it is the pregnancy, so 10 to 14 days course of the nitrofurantoin or amoxicillin. So this is the kind of line of treatment in case of the cystitis in pregnancy. So this is all, and we already know if it is a pyelonephritis, there is an abscess here, and abscess, how to go for the investigation. In cystitis you don't have to go for any severe kind of investigation, you just go for the urine culture. Okay, so female uncomplicated cases, trimethoprim, sulfamethoxazole for 3 days. In spite of sulfamethoxazole, you can add the fluoroquinolone. Cystitis plus diabetes mellitus 7 days, not 3 days. Male uncomplicated, here the dose is not for 3 days, it's for 10 to 14 days. But if it is in pregnancy, again in female in 10 to 14 days, you don't use this drug, nitrofurantoin and amoxicillin, the drug of choice. So this is all about your very short. In short, I explained what exactly the urinary tract infection, how it is divided into upper urinary tract infection and lower urinary tract infection. How will you find out the infection? What are the signs and symptoms? Why it is common in female? Okay, and then how will you treat? What investigation you are going to do? So in this way, in this pharmacological lecture series of infectious disease pharmacology, we will see all the infectious disorder in the same way, one by one. So thank you.